Hello and welcome back to my channel. Today we're going to talk about a condition that affects millions of people around the world, carpal tunnel syndrome. What it is, how to recognize the symptoms, how it's diagnosed, and most importantly, how it can be treated and managed. Let's get started. Carpal tunnel syndrome is a condition that occurs when the median nerve, one of the main nerves supplying your hand, becomes compressed or squeezed as it travels through the wrist. The median nerve passes through a narrow space in the wrist called the carpal tunnel, which also contains tendons that help move your fingers. This tunnel is rigid and tight, made up of bones and a strong band of connective tissue. Because there's not much extra room in this area, anything that causes swelling or reduces the space inside the tunnel can put pressure on the nerve. When the median nerve gets compressed, it disrupts normal nerve function, leading to a range of symptoms that can affect your comfort, your ability to work, and your overall hand function. Now let's talk about those symptoms in more detail. The most common symptoms of carpal tunnel syndrome include numbness, tingling, and burning sensations, particularly in the thumb, index finger, middle finger, and part of the ring finger. Interestingly, the little finger is not commonly affected, and that distinction can help doctors tell the difference between carpal tunnel and other types of nerve issues. These sensations may come and go at first. People often notice them at night, especially if they sleep with their wrists bent. You might wake up with your hand feeling like it's fallen asleep or feel the need to shake it out. Over time, the symptoms can happen during the day too, particularly when doing things like holding a phone, typing, driving, or reading a book. As the condition progresses, the numbness can become more constant and you might begin to notice weakness in the hand. People often report dropping objects or having difficulty with fine motor tasks like buttoning clothes, holding a coffee mug, or writing with a pen. In advanced stages, the muscles at the base of the thumb can shrink, a process called thenar muscle atrophy, and this can lead to a loss of grip strength. So what causes the carpal tunnel to become too tight or inflamed? There are many different factors that can contribute to carpal tunnel syndrome. One of the most common causes is repetitive hand and wrist motion. Jobs that involve typing, assembly line work, or frequent use of vibrating tools are common culprits. Anything that puts prolonged or repetitive strain on the wrist can irritate the tendons that run through the carpal tunnel, causing them to swell and squeeze the nerve. Certain medical conditions also raise the risk. These include diabetes, thyroid disorders, rheumatoid arthritis, and obesity. Hormonal changes during pregnancy can cause swelling in the wrists, making carpal tunnel syndrome more likely, even though it often resolves after childbirth. Wrist injuries, such as fractures or sprains, can also alter the shape of the tunnel and put pressure on the nerve. Sometimes no obvious cause can be found and the condition just develops gradually over time. So, if you or someone you know is experiencing these symptoms, how is carpal tunnel syndrome diagnosed? Diagnosis of carpal tunnel syndrome usually starts with a detailed history and physical exam. Your healthcare provider will ask about your symptoms, when they occur, what seems to trigger them, and how they've progressed over time. They may perform specific maneuvers that place pressure on the median nerve to see if they reproduce your symptoms. One commonly used test is called Phelan's maneuver, where you flex your wrist by placing the backs of your hands together and holding that position for about a minute. If this causes tingling or numbness in the fingers, it may be suggestive of carpal tunnel syndrome. Another is Tunnel's sign, where the doctor gently taps over the median nerve at the wrist. A tingling sensation in the fingers is considered a positive sign. To confirm the diagnosis or rule out other conditions, your doctor may recommend nerve conduction studies or electromyography, often referred to as EMG. These tests measure how well the median nerve is conducting electrical signals and whether there are any damage to the muscles it supplies. These are especially helpful if the diagnosis isn't clear or if surgery is being considered. In some cases, imaging like ultrasound or MRI may be used to look at the soft tissues in the wrist to rule out other causes of symptoms, but these are not always necessary. Once the diagnosis is made, what comes next? The good news is that carpal tunnel syndrome is treatable, especially if caught early. Management strategies depend on how severe the symptoms are and how much they're interfering with your daily life. In mild to moderate cases, conservative treatments are often very effective. One of the first things doctors often recommend is wearing a wrist splint, especially at night. These splints keep the wrist in a natural position, preventing it from bending in ways that put pressure on the median nerve. Many people find that just wearing a splint while sleeping can make a big difference. Reducing activities that aggravate the condition is also helpful. If your symptoms are linked to computer use or other repetitive tasks, changing your posture, adjusting your workspace, or taking frequent breaks to stretch your hands and wrists can help relieve pressure on the nerve. Ergonomic keyboards, mouse pads with wrist supports, and voice recognition software can all be helpful tools. If inflammation is contributing, then non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen can be used to reduce swelling and pain. However, these medications don't treat the underlying problem, they only provide symptom relief. Another option is a corticosteroid injection directly into the carpal tunnel. This is a more targeted way to reduce swelling around the median nerve, and many people experience significant short-term relief. However, the effect may wear off over time and repeated injections aren't always recommended. For people with persistent or worsening symptoms, despite conservative measures, or for those with significant weakness or nerve damage, surgery may be necessary. The most common procedure is called a carpal tunnel release. During this procedure, the surgeon cuts the ligament that forms the roof of the carpal tunnel, which relieves pressure on the median nerve. This surgery can be done using an open approach with a small incision in the palm or through an endoscopic technique that uses a tiny camera and smaller incisions. Both methods are typically outpatient procedures and most people recover well, often with significant improvement in symptoms. Some soreness and stiffness can occur during recovery, but hand therapy or physical therapy can help speed up the healing process. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, it's important to know that the longer the nerve has been compressed, the more difficult it may be to fully reverse symptoms. That's why early diagnosis and treatment are so important. So, can carpal tunnel syndrome be prevented? In some cases, yes, especially when it's related to repetitive activities or poor wrist positioning. If you use your hands a lot at work or during hobbies, be sure to give your wrists a break. Stretch your fingers, flex and extend your wrist gently, and avoid staying in one position for too long. Maintaining a healthy weight, staying physically active, and managing underlying conditions like diabetes and arthritis can also reduce your risk. Paying attention to how you hold your wrist while typing, using tools, or sleeping can go a long way in preventing irritation of the median nerve. Carpal tunnel syndrome is a common but manageable condition. Whether you're dealing with occasional tingling at night or persistent hand weakness, there are treatment options that can help. The key is recognizing the symptoms early and taking steps to relieve pressure on the nerve before long-term damage occurs. If you're experiencing signs of carpal tunnel syndrome, don't ignore them. Talk to your healthcare provider and discuss your options. With the right approach, you can regain comfort, protect your hands, and get back to doing the things you enjoy. Thank you for watching. As always, take care of yourself and make the most of your day.